What happens to your body if you don't get enough sleep? Sleep is not merely a luxury. It is a fundamental necessity for maintaining a healthy mind and body. Failure to obtain adequate sleep can lead to a cascade of negative consequences, like memory loss, a lower sex drive, and greater risk of heart disease. Let's explore the significant impacts of sleep deprivation. Cognitive impairment. Even missing just one night of sleep can lead to major cognitive issues. Cognitive impairment due to sleep deprivation encompasses memory deficits, reduced attention and concentration, impaired problem-solving and decision-making, slower reaction times, emotional disturbances, and diminished cognitive flexibility. The consequences of these cognitive challenges can extend into various aspects of life, from academic and professional performance to personal relationships and overall well-being. Prioritizing adequate and restorative sleep is essential to maintain optimal cognitive function and support a healthy mind. Memory. Sleep plays a crucial role in consolidating information and committing it to memory. Insufficient sleep not only makes you forgetful but can also hinder the process of learning and memory retention. During the various stages of sleep, particularly during slow-wave sleep and REM sleep, the brain actively processes and consolidates information. It's as if the brain is sorting through the day's experiences, selecting what's essential to remember and what can be discarded. This process is critical for long-term memory formation. However, when sleep is truncated or disturbed, this consolidation process is incomplete. As a result, information remains fragmented, and memories may be less stable and harder to retrieve. This can manifest as forgetfulness, difficulty recalling details, and even memory lapses in everyday life. Libido. Sleep deprivation can diminish your sex drive. Research has shown that sleep plays a crucial role in regulating hormonal balance in both genders, including the production of sex hormones. In women, sleep disturbances can disrupt the delicate interplay of hormones like estrogen and progesterone, which can, in turn, affect sexual desire and mood. Sleep-deprived women may experience a decrease in their overall sexual motivation and arousal levels. Men who experience sleep loss show a decrease in testosterone levels. Furthermore, their overall mood and vigor declined with each consecutive night of interrupted rest. The emotional toll of sleep deprivation can also impact intimacy within relationships. Feelings of irritability, fatigue, and stress, which are often associated with insufficient sleep, can strain the emotional connection between partners, further influencing sexual desire. Weight gain. Sleep deprivation disrupts the delicate balance of hormones that regulate appetite and hunger. Two key hormones affected are leptin and ghrelin. Leptin is responsible for signaling to the brain that you've had enough to eat. Sleep deprivation leads to reduced leptin levels, making it more challenging to recognize when you're full, potentially leading to overeating. Ghrelin, on the other hand, is an appetite-stimulating hormone. Sleep deprivation increases ghrelin levels, intensifying feelings of hunger and driving cravings for high-calorie, often unhealthy foods. Fatigue and lack of motivation resulting from sleep deprivation can deter individuals from engaging in regular physical activity. This sedentary behavior compounds the problem of weight gain. Sleep deprivation can also alter the body's metabolic processes, leading to an increased tendency to store fat. This shift in metabolism can make it more challenging to lose weight or maintain a healthy weight. Diabetes risk. Sleep deprivation is associated with an increased risk of developing adult-onset diabetes. It can lead to insulin resistance, a condition in which the body's cells become less responsive to insulin. Insulin is essential for regulating blood sugar levels. When cells are resistant to insulin, it becomes harder for glucose to enter cells, leading to elevated blood sugar levels. During deep sleep stages, the body's sensitivity to insulin increases, helping to maintain stable blood sugar levels. Sleep deprivation disrupts this process, resulting in poor glucose regulation and increased blood sugar levels. Sleep-deprived individuals often experience increased appetite and cravings for high-carbohydrate, sugary foods. These dietary choices can lead to spikes in blood sugar levels, putting additional stress on the body's ability to regulate glucose. Less sleep also triggers the release of stress hormones like cortisol, Elevated cortisol levels can further contribute to insulin resistance and disrupt glucose metabolism. It is associated with increased levels of inflammation in the body. Chronic inflammation can impair insulin signaling and contribute to the development of insulin resistance and diabetes. Accident proneness. It's clear that insufficient sleep significantly increases the likelihood of accidents and injuries. Key factors contributing to this risk include impaired reaction time, decreased alertness, microsleep episodes, impaired cognitive function, and a higher risk of accidents while driving or in safety-critical industries. These accidents can have serious consequences, affecting an individual's quality of life and potentially leading to physical disabilities, emotional trauma, and financial burdens. Prioritizing adequate and restorative sleep is essential for personal well-being and public safety, as it mitigates the hidden dangers of accidents resulting from fatigue. Skin health. Sleep plays a crucial role in maintaining healthy skin, and sleep deprivation can lead to a range of skin issues that affect your appearance. Sleep deprivation accelerates the aging process, leading to premature aging signs such as wrinkles, uneven skin tone, and loose skin. Sleep deprivation increases inflammation in the body, which can manifest on the skin as redness and puffiness. Inflammation can exacerbate skin conditions like acne, rosacea, and eczema. Lack of sleep often results in the appearance of dark circles under the eyes and puffiness. This is due to poor circulation and fluid retention in the eye area. It can also weaken the skin's natural barrier, making it more susceptible to environmental pollutants, UV damage, and irritants. This can lead to increased sensitivity and skin problems. Even more important, sleep is a critical time for the body to repair and regenerate tissues, including the skin. Sleep-deprived individuals may experience delayed wound healing and longer recovery times after skin injuries or surgeries. Immune system. Sleep deprivation weakens the immune system's ability to respond effectively to threats like viruses and bacteria. This can result in longer-lasting illnesses and increased susceptibility to infections. It negatively affects the production of infection-fighting cells, such as T cells and cytokines. These cells play a crucial role in identifying and destroying pathogens. When sleep-deprived, the body takes longer to recover from illnesses. Even common colds and minor infections can linger for extended periods, impacting overall health and well-being. Over time, chronic sleep deprivation can increase the risk of developing chronic diseases, as a weakened immune system may struggle to combat ongoing health challenges. Cardiovascular health. Sleep deprivation is associated with an increase in both systolic and diastolic blood pressure. This sustained high blood pressure can contribute to the development of hypertension, a major risk factor for heart disease and stroke. Prolonged sleep deprivation has been linked to a higher risk of developing heart disease, including conditions such as coronary artery disease and atherosclerosis. These conditions can lead to heart attacks and other cardiac events. It can disrupt cholesterol metabolism, leading to unfavorable changes in lipid profiles. Elevated levels of LDL cholesterol and lower levels of HDL cholesterol are associated with an increased risk of heart disease. Sleep deprivation can lead to irregular heart rhythms, including atrial fibrillation. These disturbances can increase the risk of blood clots and stroke. Respiratory and digestive systems. Sleep apnea, often caused by sleep deprivation, can negatively impact your respiratory system and increase vulnerability to respiratory infections. Sleep deprivation has been associated with an increased risk of digestive disorders such as gastroesophageal reflux disease and irritable bowel syndrome. The disruption of the body's circadian rhythms can affect the normal functioning of the digestive tract. It's evident that sleep is not merely a luxury. It's a critical component of a healthy lifestyle. To mitigate the adverse effects of sleep deprivation, strive for 7 to 9 hours of quality sleep each night. If sleep problems persist, consult a healthcare professional to rule out underlying sleep disorders and receive appropriate treatment. Prioritize your sleep, and in doing so, prioritize your overall well-being. If you enjoyed this video, don't forget to like and subscribe so we can create more content like this. Thanks for watching, and see you next time. Check out this video next to learn more about the best tips to improve your sleep.